Today we're going to talk about gastroparesis. August is Gastroparesis Awareness Month. As you probably know, there is no cure for gastroparesis. It's a very complex disease where patients feel bloating, nausea, vomiting, because their stomach is not really emptying itself very well. So food stays there much longer than necessary and will create all these very annoying symptoms that will have a big impact on your daily life. Unfortunately, there is no cure for this disease, but there's multiple treatments. It's impossible to make the stomach squeeze itself better. But one of the newest treatments, which is something that here at Brown Surgical Associates we've been trained at, me and with the other surgical partners, it's basically called a POP procedure or a G-point procedure. Fancy name that means Per-Oral Pyloroplasty. In the past, one of the treatments, not cure, for gastroparesis is to make the stomach open up a little bit better by cutting the muscle that separates the stomach from the small intestine. By opening that valve, the stomach empties itself a little bit better and provides some relief. Historically, that's been done with surgery, either open procedure, laparoscopic procedure, even robotic now. POP or G-point, it's a new procedure that has been around for the last 5 to 10 years, which uses the same concept, cutting the muscle, but without a surgery, without incisions. Everything is done through the mouth, through an endoscopy. So the patient comes to the hospital, totally asleep. We go inside the mouth with a camera. We look inside the stomach, make sure that the anatomy, right, everything is favorable, that this is safe to do. And then from the inside, we cut this little muscle to open it up to hopefully make the food empty itself better into the small intestine, providing some relief. The research shows that there's a statistically significant chance of feeling better. The hard part is that we can't truly quantify the symptom improvement that each patient will have. I have some patients that they feel like they're almost back to normal, right? Not quite normal, but they feel much better. They feel like they can go out and eat at a restaurant. And other patients may have relief, but not as dramatic. So it's very, very important that you have a discussion with your provider, with one of us if you want to, and we can go over the expectations, because this is something that you have to know. Risk of complications for this procedure is extremely low, but you have to know about it. So make sure that you talk to a provider that knows what they're doing. They can tell you exactly if this could be a good procedure for you, because you want a 360-degree care, right? We are just part of the solution as minimally invasive endoscopic surgeons. You need a good provider, medical provider, GI doctor, primary care that can take care of you at a 360 degree.